Overactive bladder means that a person urinates by mistake or accidentally, although it can happen to any person, and urinary incontinence, also called overactive bladder. Urinary incontinence or overactive bladder is more common in older people, especially in women. Bladder control problems can cause people to give up their normal activities. The main cause of a more active bladder is a leaky bladder. A bladder that cannot stop the flow of urine, which causes people to urinate more frequently, and sometimes even frequent urination at night. Overactive bladder symptoms. Female. Urinary incontinence is apparently not a disease in itself but is a symptom of another contagious disease. For example, weak muscles of the lumbar spine. In addition to urinary incontinence, some women have other symptoms of urinary incontinence. Feeling the urge to urinate suddenly and uncontrollably. In the human body, pressure or spasm in the pelvic area that causes urination and bowel movements. More than 8 times a day or more than twice a night. Urinating at bedtime means going to the bathroom more often than usual. Causes of overactive bladder or urinary incontinence. Needs to analyze this issue because there is a lot of confusion about it. The main reason is of course the side effects of the treatment, but many of the medicines used for this condition are anticholinergic. It means that they block a specific neurotransmitter called acetylcholine. Acetylcholine is a hormone inside the nervous system that affects the pelvic floor as well as mechanisms that allow you to contract and relax your bladder. Allows the whole system is collectively called the autonomic nervous system, so the drugs they use for leukemia are really affecting the autonomic nervous system. Which means because one of the root disorders is neurogenic, which this means that it is coming from the nervous system. The second reason we are talking about is idiopathic, which is a fancy term meaning unknown cause. And what we know about idiopathic or unknown causes of bladder leakage is that one of them. The main reason is that you have guessed that insulin resistance is good. Conditions where you also have high levels of insulin, which can cause changes in your autonomic nervous system. Called the detrusor muscle, the tangled part of it now is that when you research it, they pay more attention to estrogen. Estrogen deficiency, especially after menopause, because of course when women go through menopause their estrogen levels fall, so women definitely have a hormone problem which definitely affects the bladder as well as the vaginal area and body. It can affect other parts of the body as well, but the problem is when you give someone estrogen in the bladder, which does not solve the problem. May be affected when you have insulin resistance, so this problem gets worse as you get older. When a woman becomes pregnant and gives birth to a baby, especially more than one baby is born, because it affects the muscles that help you contract and relax, as it will affect its structure. The valve that controls the flow of urine through your bladder, and then there are things that increase it like chronic constipation and obesity with chronic cough and asthma problems. And of course the usual things that people drink too much and drink coffee, and these are definitely the reasons. When people are under stress, exacerbate the condition so as not to make it worse, which is very important because the first thing that is important and recommended is how stress affects the autonomic nervous system. Try even any herbal remedies or even Kegel exercises, and it will dramatically and negatively affect this insulin-resistant insulin nervous system. So when you eliminate this insulin resistance, if so, many of the problems associated with it will disappear. Diagnostic tests for overactive bladder or urinary incontinence. Cystoscopy. Urodynamics. Complete urine examination. Bladder stress test. Ultrasound. Is it normal for a woman to urinate incontinence? Urinary incontinence, or involuntary discharge of urine, is a common symptom that usually affects women. The effects of this disease increase with age, and 76% of women over 60 years of age suffer from urinary incontinence and bladder leakage problem. However, it is not a disease that is uncontrollable yet. It usually gives the sufferer a long time of tough time and adds to the anxiety. Risk factors of overactive bladder and bladder leakage. Urinary incontinence damages the bladder control system. The second and most common type of urinary incontinence that affects women is stress incontinence and desire for incontinence, also called overactive bladder. Irregularities or incontinence affect 2 times more as many women as compared to men. This is because pregnancy, childbirth, and menopause can increase the risk of urinary incontinence. However, it is possible to treat it according to medical principles. How can a woman strengthen a weak bladder? A healthy keto diet and intermittent fasting is the best thing to do for this purpose, and by really doing so you are eliminating these good carbs in 25 grams daily. You are doing a healthy version of the ketogenic diet as well as fasting from time to time. So you fast for 18 hours and you have a 6-hour meal window that will help you urinate more frequently, especially in men at night. It is very effective for this. And if your problem is really the autonomic nervous system, you are going to positively affect your bladder control function, and if you reach for herbs, then it is cured and you get rid of this basic problem of eating. Do not resolve and you do not fix insulin resistance. Herbs may not have the effect they should have and you may need to chew them well, so it is best to start with a healthy diet. The version of the ketogenic diet within a minute of fasting is right. It is the number 1 Kegel exercise. It will help you to have more control over your bladder because urination is both involuntary and voluntary, and if you do these exercises, once you start, you begin to have more control in the voluntary part of these muscles. The first way to do this is to make sure that your bladder is empty. You may want to bring your back to the bed. Want to maintain so that you do not flatten your back. You can also wrap a towel around the lower back and put it on the lower part of your waist, but this way it pushes your pelvis forward. Then you want to lift and squeeze the opening of the pelvis. They are going to do it for counting seconds. You contract these muscles and then you let them relax for 5 seconds and you go back and forth about 10 times and then do it 3 times a day, and these exercises will spread throughout the day. And as far as herbal remedies are concerned, there are some very good data with very positive effects that have been found in patents using herbs or natural remedies for more active bladder. Herbal remedy for overactive bladder. It is an herbal remedy that not only moderates the severity of the disease but also eliminates it possibly. It also strengthens the walls of the bladder and moderates overcontrol urine. This remedy has been tried and tested to moderate the frequency of urinary incontinence and even recurrent urination due to diabetes. These are potential herbs for overactive bladder. Ingredients: mastic gum, Pistacia lentiscus, Boswellia serrata, Indian frankincense, Quercus incana, Juft balut, pomegranate peel, Bolus armanus bora armani, sandalwood, Java plum or Indian blackberry seeds. Procedure: take the above 6 herbs, 50 grams and 250 grams of Java plum or Indian blackberry seeds, and clean them thoroughly and leave them in the sun for 1 hour. Now grind all these medicines well and turn them into fine powder. Use: use half a teaspoon of this powder with water in the morning, afternoon and evening after meals. This remedy is very beneficial in overactive bladder, and continuous use of this medicine can reduce the severity of this disease and eradicate it completely. I very much hope that you will like this video. Be sure to subscribe to my channel Herb Concept for the video. See you on the next new health topic.